I'm happy to launch the Agency for Integrated Care's revamp Singapore Silver Pages today. The enhancements to this one-stop online portal in terms of bringing together the information on social as well as healthcare services for both the seniors as well as the caregiver is really timely in order to support our caregivers as well as of course the care recipients. In fact, with the development of more options for seniors to be cared for in the community, even as we develop these care services for the elderly in the community, we need to enhance comprehensively the care services available to our caregivers, to provide them with useful resources to support them to better care for their loved ones. So the SSP, the enhanced SSP, would increase the level of support, make the aged care services more accessible in terms of making the information as well as the resources available more readily and easily available via the portal. And I feel that Singaporeans, both whether they are caregivers or not, they would find the information useful and educational, and I would like to encourage Singaporeans to get into the SSP, the revamped version, to find out more. In fact, the revamped version now actually has got elder-friendly features. For instance, they have a read aloud speaker, so you can actually get the website, to read aloud the articles that are already on the website, and they have got adjustable font sizes so as to make the fonts bigger and more elder-friendly, in terms of reading. So that also would be very helpful to Singaporeans who are looking for information on caregiver support services as well as information on elder care, aged care services. The ministry is also focusing on improving the quality of aged care services. So this year at our Committee of Supplies, we have announced that we will be introducing a set of enhanced nursing home care standards by 2015. And over the last few months, we have been engaging the public as well as nursing home care providers and healthcare professionals on the enhanced sets of standards via various dialogue sessions as well as our e-consultation. I'm pleased to note that the support and the response to the enhanced set of standards has been very encouraging. In fact, just a few days ago, I have actually chaired a roundtable discussion among 40 participants comprising caregivers as well as volunteers and grassroots leaders on the enhanced sets of standards. And the response has been very supportive, very encouraging. They've all welcomed the enhanced set of standards, and in fact they have acknowledged the importance of ensuring a uniformity of standards so as to raise the quality of nursing home care across the sector. Some of them have actually highlighted some areas of care that they feel needs to be strengthened. For instance, in terms of medication management for the elderly at nursing homes, as well as physiotherapy needs of the elderly at these nursing homes. Some has also shared that we need to look at the psychosocial needs as well as the well-being of the nursing home residents, by providing them, say, with recreational activities or exercises. And I'm glad that they have brought this up because in fact these are actually articulated in the enhanced set of standards, and in fact we have specified the requirements as the guide and the guidelines for the nursing home to address these needs among the residents. Another area they have brought up is, they have asked the ministry how we can help the nursing home to achieve these standards, especially in terms of manpower, training and development. Again, I'm glad that they have brought this up because manpower is key, is critical to enhancing the standards of nursing home. So some of them have actually suggested, for instance, that we could offer training to the volunteers so that the volunteers could contribute more as well as perhaps even do some simple care tasks. They've also suggested that we redesign some of the jobs at nursing homes so that more Singaporeans can come and work part-time. And I think that is really very helpful, especially when we are ramping up nursing homes, building nursing homes within residential areas for greater accessibility. So by redesigning the jobs, that could allow like back to work women, staying within the vicinity of nursing home to come back to work on a part-time basis. In the meantime, of course, the Ministry of Health as well as AIC is continuing to invest in developing the manpower in this sector. So for instance, just last year, we have actually enhanced the training, the funding support available to this sector, in order to help them to recruit as well as retain staff. We have enhanced the funding support so that they can make salary adjustments, as well as, of course, help them in terms of training, and also to incentivize them to improve their manpower staffing ratio. We of course also provide training grants and programs to upgrade the skills of the care staff in the nursing homes. And with the enhanced set of standards, we are going to implement several new programs, 6 new programs, training programs in fact, to take care of some of these new areas like advanced care planning, as well as fall preventions, to upgrade the skills of the nursing care staff so that they can meet these standards. And I think one other area that the feedback participants have actually raised is their concern about the affordability of nursing home. They are worried that perhaps the nursing home fees will be increased with the enhanced set of standards. We continue to work with the nursing home care sector to ensure affordability of nursing homes. So again, just last year, we have actually improved the subsidy framework for the ILTC sector, so that in terms of widening the income eligibility criteria, as well as increasing the subsidy levels. And with these changes, actually about two-thirds of a Singaporean household will be able to benefit from some form of subsidy with this revised subsidy framework. And in fact, the most significant increase in subsidies will be to the middle income households. But we will continue to work with the nursing home sector to ensure cost effectiveness. So for instance, where there are services that can be consolidated in terms of demand, to consolidate the demand, share the services, consolidate the demand, and drive down costs. We are doing that. So some of the DWOs have come on board an initiative, a group procurement initiative, so that they can bulk purchase some common nursing supplies like milk powder, diapers, and so on, to reduce costs. And we're also looking at shared services in terms of allied health services as well as pharmacy services, again to consolidate demand and drive down costs. We are also making available, of course, the $110 million healthcare productivity fund to the nursing home sector, so that they can provide training as well as other projects that will help them to improve their productivity, again to contain costs, make it more cost effective. AIC also is preparing a guidebook to help the sector, give them more details about the intent as well as the specific requirements of each of the enhanced set of standards, so that they can better prepare and help meet the guidelines. They are also putting in within the guidebook, good practices that the nursing homes can adopt, as well as self-assessment checklists. And all these are to really help the nursing home to be able to gear up and meet the enhanced standards. So I think that if we work together with all our stakeholders, we will be able to roll out these new enhanced set of standards to raise the quality of care in a way that is achievable to the nursing home, and at the same time affordable for Singaporeans. And these are some of the areas that we are focusing on at this point in time. Now we are doing our public consultation. It's coming to an end, and then we will be taking into account all the feedback that have been given. In fact, I want to thank all the participants for giving this feedback. It has been very useful, and the nursing home standards work group will carefully consider all these suggestions, refine the set of standards, and come up with the new set of standards very soon.